My name is Hans Tinneberg. I'm Professor of Gynecology and Obstetrics, and I'm dealing with endometriosis and endometriosis patients for many decades. Today's question is endometriosis and food. And the question is, can a change, a conversion of our food habits reduce symptoms and also the disease as such? Or can it even accelerate the disease? And for instance, would it be advisable to omit wheat and soybeans? Now, first of all, in order to answer this question, we need to realize that inflammation is a very important aspect of the disease endometriosis, because endometriotic implants of endometriotic tissue outside of the uterus are usually associated with a surrounding inflammation. This inflammation is responsible for pain and for other symptoms like bloating and disorders. In order to reduce this inflammation, it has been advised to increase the uptake of fruits and vegetables. Fruits and vegetables are known to reduce oxidative stress and also inflammation. Also, omission of red meat, dairy products, and unsaturated fatty acids is also known to increase the reduction of inflammation and oxidative stress. Now, one aspect that needs to be mentioned in this respect too is quite new research into the microbiome of the gut. Basically, we know very little about these bacteria in the gut and how they can influence diseases and our decisions. But there's one thing we know, and that is that the distribution of gut bacteria can also be associated with inflammation. Inflammation in general, but also inflammation associated with endometriosis. What can we do in order to influence this? And that is, we can try to change the microbiome by perhaps using special probiotics like special yogurts, but also formulations where a certain kind or species of bacteria are found. Finally, it is not necessary to omit wheat and soybeans, even though we know that wheat and soybeans includes phytoestrogens, and estrogens are known to increase the disease level of endometriosis. But there is no evidence, and that is the final result. There is no particular evidence that the food can actually cure the disease of endometriosis.